Hello, everyone. Today I'll be presenting the mystery and cause of equine shivers. It's about time that we put this whole subject to rest of what the true cause is. And today we're going to work on strictly the history and published research. I believe in the KISS theory, where you keep it simple, stupid. It's not going to be a lot of information. It's just going to be veterinary research, and also you're going to be able to read and look at. You can stop the PowerPoint presentation where you can read what not only myself, but other veterinarians centuries ago have also stated about their hypothesis of what is causing shivers and stringhalt in horses. I realized from doing the research that those that came before me, that I have to keep their name alive to this day because they also confirmed what my own hypothesis was when I first saw my first clinical case in 2008. So the veterinary profession was established in 1761 in Lyon, France. The veterinary books go back for centuries, all the way back to the 1520s. I found information about shivers and stringhalt in 1600s that stated about hypotheses on what was causing shivers and stringhalt. And so in all those recorded books, for however long the veterinary profession has been around, shivers and stringhalt has also been mentioned. Shivers was considered as common as dirt in the pre-industrial revolution, when horses were the only means of transportation. The prevalence of seeing horses with clinical signs of shivers was extremely high. The same thing with horses that had strictly stringhalt. And then all books mention horses that had shivers and stringhalt clinical signs in both the front limbs and the hind limbs. The veterinary profession today considers it a movement disorder. We know it's progressive, and we have concerns of quality of life. It affects equid species worldwide, and research states that there's no known effective treatment, and the only options that we give to owners as veterinarians, besides myself and people that I've trained, is humane euthanasia. This is a cute little video of how I kind of feel the veterinary world is not focused on the horse. It's an inclusion-exclusion type hierarchical caste system where people are excluded if your ideas don't fit the mode of what's actually published. And so this presentation will actually help you see the history and the science and the logic that not only myself, but other people prior to the 20th century actually had the same logic about. So this is from the veterinary record in 1930, February 1st, 1930. And you can see it says shivering. William Williams actually was the first veterinarian in the Principles of Practice of Veterinary Surgery, the 4th edition. He talks about his hypothesis on what's causing shivers in 1882. And he stated the same thing that William McCall and William Williams states. And we'll read this so you'll understand what his hypothesis was. Gerald McCall, the same way, stringhalt and shivering in the proceedings of the 28th meeting of the National Veterinary Association in London in 1910. And then William Mitchell, this is his paper on the veterinary first in 1930, which he stated some aspects of osteoarthritis of the vertebral column. And then he came back again in June 21st, 1930, and he said some further observations on pathological changes found in horses affected with shivering and their significance. So this is William Mitchell, that same paper in February 1st, and he says, I think you must all agree from the figures given and specimens exhibited that osteoarthritis affecting the vertebral column is not only fairly common in old horses at any rate, but also the lesions are very variable. A pure pathological study of the specimens would have been very interesting, but my object has been to try and connect up clinical signs of some conditions, the etiology of what is unknown, with gross pathological findings. This investigation is obviously very incomplete without considering more evidence, especially from young animals, and I must confess that my main object is putting forward my view is to gain your help to obtain some animals for the further study. Stringhalt shivering. The cause of the condition, Stringhalt and shivering, was last investigated in this country, as far as I can gather, by McCall, who had the spinal cord and the brain examined for degeneration in the case of each, but nothing abnormal was found. The contention is that shivering and Stringhalt are merely signs of osteoarthritis affecting the vertebral column, and that the varying site of muscle spasm depends upon the nerve roots implicated, the greater frequency of the signs of these two conditions occurring in the hind limbs. So William Mitchell stated this, and there's another slide. So the first case was a 16-year-old heavy draft horse. He had shivers only in one hind limb. There was a case number 2. These were all necropsies that he did. 23-year-old heavy draft with bilateral hind limb shivers. Case 3 was an age-light draft gelding, shivering and grunting, what they consider grunting. Case 4, there was no description. The horse had a jink back, but difficulty backing. And then the 5th case was actually a 14-year-old show jumper that didn't have a necropsy, but it had Stringhalt bilaterally in its hind ends. And they actually did the peroneal tenectomy on that horse and actually made it worse. So Williams continues, and this is a discussion on February 1st. Mr. Inglis opened the discussion. He said, "Wish to thank Professor Mitchell for his admirable address and for the trouble of taking in preparing it and bringing such a representative collection of pathological specimens to support his claim. The first thing that struck him was that it was highly essential that they should attempt to follow through and detail postmortem more of these bony conditions in horses which they were usually content to condemn and lose all interest in. He thought that the theory was just new, for he remembered that William Williams recorded 2 cases of exotosis of the ilium causing Stringhalt, and that several continental workers had also associated bony disease with a well-known nervous condition of shivering. He thought, however, that the address was most stimulating and desired to express his thanks to Professor Mitchell." So this is Professor Mitchell way back in 1930, February 1st, 1930, presenting this to the veterinary board, the veterinary record, with necropsy samples of what he's finding. So they ask him to come back. So he comes back June 21st. "I think I can assert that a horse which is shivering will always show some evidence of osteoarthritis, often clinically, but certainly on postmortem examination." So he talks about it, one of the cases had separation, all this stuff. You can read it. You can stop the PowerPoint presentation and read it. But this is really important. "In the old horse which I examined, gross changes on osteoarthritic nature were the outstanding features, especially in the vertebral column, and I suspected that the signs of shivering might be due to the pressure effects on the roots of the nerves going to form the lumbosacral plexus. Since then, I have been able to examine postmortem 3 definitive shivers, age 2, 4.5, and 5 years respectively, and again, osteoarthritis has been the prominent feature, although there were no marked exotoses on the vertebrae which one could incriminate as possibly causing pressure on the lumbar or sacral nerve roots. In all, I found synovitis of the costal-vertebral articulation with varying size erosions of the heads of the ribs from the effects of the synovial overgrowth in 3 joints. The hip, stifle, shoulder, elbow, tibial tarsal joints showed some degree of early arthritis, though the joints from the fetlocks down showed no appreciable change. The point I wish to stress is that I have yet to examine a shiverer, young or old, in which there is no osteoarthritis. The difference between old and young horses affected with shivering is that in the old horses there was marked evidence of the nature's effect to repair joint damage by bony and cartilaginous hyperplasia, seen well as lipping of the articular surface of many joints. An extraordinary thing in my mind is the absence of lameness in all the shiverers I have seen, though gross pathological changes are to be found in many joints, and there holds on many horses other than shiverers." So what William Mitchell is saying, that these horses that he saw, 2, a 4.5, and a 5-year-old, all these horses, and his hypothesis of the lumbosacral plexus being the muscles pushing up on the ventral nerve roots of the lumbosacral plexus, causing these clinical signs. So post-industrial revolution, there was a huge dramatic drop in the prevalence of shivers. Stringhalt, and also horses at Shivers and Stringhalt, except for the draft horse industry, the carriage and the Amish industry, the racehorse industry. And then in the 1980s, the sport horse industry, there was a surge in prevalence as the sport horse and performance horse industry started getting more prominent. In 1999, Valentine and Delahunty published this paper on the clinical and pathological findings in 2 draft horses with progressive muscle atrophy, neuromusculature weakness, and abnormal gait characterized as Shivers syndrome. Now, they were calling it a syndrome too, as I have. And so they state, here we go. Although Newman's proposed that Shivers is a peripheral nerve disorder, and Newman is a veterinarian actually in the Quad Cities in Iowa, and he did tons and tons of draft horse. He's predominantly in the draft horse industry, but he published a paper that actually also said that he thought that this was a peripheral nervous system problem or lower motor neuron problem. Anyways, we could find no reports documenting peripheral nervous system or CNS, which is your brain and spinal cord, abnormalities in horses with Shivers. Although polysaccharide storage myopathy has been described most often in Belgian and Percheron draft horses, this diagnosis has been confirmed in Clydesdale-Shire and Haflinger breeds following testing of muscle specimens. Complete examination of the PNS and CNS included motor and sensory components, revealed no histological abnormalities in our horses. However, motor and sensory nerve conduction velocity tests were not attempted, and a functional abnormality of the peripheral nerve or central nervous system reflex arcs cannot be entirely ruled out. The muscle atrophy and weakness in our horses with severe advanced Shivers are considered typical of neuromuscular disease, and the histopathological findings of chronic myopathy change with abnormal accumulations of glycogen and complex polysaccharides are pathognomonic of polysaccharide storage myopathy. So they didn't find anything, even though they looked over the bodies of these draft horses. So then in 2006, there was a paper, Shivering in the Horse, a Review. And so this was done at the University of Minnesota with Anna Furshman, Bard, and Valberg. And the course of the disease, everybody knows that they stated here that the hypothesis was that there was a genetic cause, which was in the UK way back in 1918. And this is the most important thing. In many horses, the clinical signs of Shivers may remain static. However, in almost all cases, the condition is slowly progressive and debilitating disease. Horses that are slight Shivers may work satisfactorily for many years, but eventually the spasms increase both in frequency and severity. Hunting horses, moderate fence work, it has been stated that shivering involving the forelimbs seldom interferes with the animal's capacity to work. The signs gradually increase in severity and intensity until the horse is eventually rendered useless. The prognosis for affected individuals is generally unfavorable to poor because the disease is usually progressive. In a horse with Shivers, the tendency is for the spasms to increase both in frequency and severity. The long-term prognosis for athletic function is grave. Eventually, Shivers symptoms may result in death or euthanasia because of profound weakness, muscle wasting, and apparent discomfort and incapacitation associated with episodic muscle cramping. So that was in 2006. In 2010, this veterinary student wrote her PhD paper. You can see it says thesis. And this is really awesome because this is Jean-Marie Denois. And Jean-Marie Denois is rectally palpating a horse. And it states here that the right hind in the horse with generalized elevation, where Denois could actually cause Shivers clinical signs when he was rectally palpating on this horse. And the same thing with another veterinarian down below here, the same thing, he could repeatedly, by pushing up on the iliopsoas, cause clinical signs of Shivers in horses. Now this is 2010 when this thesis was done. In 2013, Alex Draper, who was at the University of Minnesota, did a research paper on this, And it's interesting when you read this, a picture of a horse with Stringhalt way back in 1912. And you can see this horse's abduction to its hind leg, but it must have had Stringhalt and Shivers at the same time. And you can see the body condition of this horse is so horrible. So Dr. Alex Draper did her PhD on that. And after that, they published with Draper, Firschman, Valberg, and some other people, posture and movement characteristics of forward and backward walking in horses with shivering and acquired bilateral Stringhalt. And what they said here was, hang on, I got to make this thing bigger because I can't see. Shivering affects backward walking with either hyperflexion or hyperextension and can gradually progress to involve, well, anyways, you can read it if you look real close. What they're saying is some of these horses had Stringhalt clinical signs too, walking forward or backwards. So then in 2014, they did an epidemiology study of shivering in horses, the same people, and they were saying that most horses were of 7 years or older and big. And the truth is, I've seen horses, hackney ponies, miniature donkeys, miniature horses with Shivers and Stringhalt clinical signs, and actually have treated them, including mules. So it doesn't really fit this hypothesis very well of what they're stating. It was just in their patient population of what people sent them, 300 and something cases. And then in 2015, this was published in Veterinary Pathology. The equine movement disorder Shivers is associated with selective cerebellar Purkinje cell axonal degeneration. And this paper actually is the paper that changed my life and made me actually have to come out of my little bubble and where people would actually, I actually had to fight to save these horses' lives. This paper was based on 5 cases, Shivers cases, and they're pretty much stating that this condition called Shivers is caused by a cerebellar lesion, Purkinje cell axonal degeneration in the deep central nuclei. It's amazing to me that the veterinary profession has accepted this based on 5 cases, but that is what happened. And so I put this slide back up too. So how is it possible if the brain is responsible for the creation of clinical signs of Shivers, the horses having Shivers, when Jean-Marie Denois, one of the top veterinarians in the world, and another veterinarian down below here in this picture, can rectally palpate the horse and create Shivers clinical signs? That doesn't make, you're at 2 separate ends, you're at the hind end and the brain. I don't understand how you can connect those two, but obviously over 5 cases, people have somehow accepted that the brain is the problem, and Jean-Marie, one of the top veterinarians in the world, is causing it by actually rectally palpating a horse. So it doesn't make a lot of logical sense to me, but we're going to carry on with this history. So then this EMG study I really like. It's also abnormal locomotion muscle recruitment, activity presented in horses with shivering, and Purkinje cell distal axonopathy. Sorry, tough word. They did an EMG study, and it actually confirms exactly what I'm saying is the cause, and it actually backs up. If you understand that this is a lower motor neuron problem, you will understand that the EMG studies actually confirm that it's a lower motor neuron problem. But I really like this study done. And then that was in 2018. In 2019, Dr. Kathy Sano, myself, Michaela Vig, who is also a board-certified veterinarian currently today, we actually did a 3-dimensional kinematic analysis of shivers in horses, a pilot study. That is using 3-dimensional kinematics is actually the gold standard of research. for motion analysis, for movement disorders in humans or in animals. It's used in all professional athletes and in the top research institutions in the world, including NIH. So we did this research study with putting dots on horses, and then I'm going to show you the videos of this horse that has the kinematics. You can see these horses, the dots on it to show all the movement of what's happening. He has a wide base stance, and he shows the clinical signs of shivers whenever I go to pick up his hind legs. I want to thank Tom Secord for doing the kinematics and making these images here. But you can see that this young horse is shivering severely. And it's a very, very painful condition, you guys. This is very painful. And you see me in the background. It really upset me to see the horse do that. And so I go to pick up, and it's very dangerous to pick up these horses' legs. Go to pick it up again. And they can't unlock. They can't pick up their leg for a reason. And that is a lower motor neuron reason. And then this is post-treatment, day 49. And same horse. As you can see, I'm just walking around the horse. You can see that the horse's stance is much more narrow. And I can just walk around this horse and pick up its legs normally. If this was a cerebellar or Purkinje cell deep central nuclei degeneration, there is no way that this horse could actually stand and me pick up its legs or walk with any symmetry to its gait. Any lesion in that region or degeneration in those lesions in that region of the brain creates complete ataxia and also hyper movement, hyper dystonia in cramping, spasming, and hypermetric movement. And you can see here, I just keep walking around this horse and picking up its hind legs. As I've said before, I am not a brain surgeon. You can see me putting one of the little dots back on it for the kinematic cameras, but I am definitely not a brain surgeon. I did not do brain surgery on this horse. And there's no way of fixing Purkinje cell degeneration in horses or humans or any species that I know of at this time. They're still working on research for that to help people that have degenerated cerebellar lesions. There are some means to help people, but they are all ataxic. And then in 2022, there was a review, Shivering and Stringhalt in horses, just to try to keep this at the forefront of their hypothesis. And then a review done, movement disorders in cerebellar abioptrophy, and they brought in Shivers and Stringhalt also in that. In 2023, just a couple years ago, Dr. Valberg and some other people, Dr. Carrie Fino, who's an exceptional veterinarian out in UC Davis, cerebellar axonopathy in Shivers horses identified by spatial transcriptive and whatever, you can read it. Anyways, their conclusion with, I don't know how many horses, 5 horses, 5 Shivers horses, again, the magic number 5. You can read what their conclusions was, but I don't think they're going to find what they're looking for by looking in the brain. So Stringhalt research history, I need to go through this really quickly, and you can see I'm using this little horse diagram because the horse is speaking and everybody has a little bit of a more consensus versus an inclusionary, exclusionary type attitude with it, where people are willing to at least tempt the surgery for horses that have Stringhalt, but the majority of the horses it does not work on. And so if you do a Google search, scholar search, you'll see there's 650 type published papers that come up. The surgery is a lateral digital extensor tenectomy and the middle patellar ligament cutting. In Australia, you have the false dandelion, which also creates clinical signs of Stringhalt. But this is a very interesting paper. In 1850, a veterinarian named Harger published this, and I'm going to read it to you. Rousseau, a French army veterinarian, is of the opinion, after a number of observations, that the spinal cord is the seat of the lesion. He performed plantar and sciatic neurectomies to exclude the lower portion of the member, which did not influence the movements. Double string heart, arching of the back, tucked up flank, and sensitive loins yielding readily to the pressure of the hand. Difficulty in exaggeration of the movement in turning led him to locate the trouble in the lumbar region of the spinal cord. He made one autopsy and found an abundance of arachnoid fluid, a yellowish coloration of the inferior motor nerve roots, while the superior were white, and some vascular congestion. The member otherwise was normal. So what he's saying there is the ventral, the inferior nerve roots had this archaic fluid, a yellow coloration, and the superior, which is on top, the dorsal nerve roots, were white and normal. This theory would best explain many of the different phenomena observed and the variations in the muscle regions affected. The nerves emanating from the lumbosacral plexus originate in different parts of the spinal cord, and hence the altered movement, muscular contraction in any given case may vary according to the portion of the cord affected. Comparing the flexors and the extensors, the altered movements may develop under two conditions: excessive contraction of the flexors or loss of coordination between the flexors and the extensors. The first proportion explains itself. As to the second, during locomotion, the contractions of the flexors and extensors follow successively and harmoniously, first the one set and then the other. If this harmony is disturbed, and if the one contracts before that of the other has ceased, the movements become antagonistic and irregular. Thus, if the flexors commence to contract before the extensor force is expended, the flexors must contract with additional force to overcome the latter, and thus impart a jerky movement to the leg. There is, as it were, an antagonism between the extending and flexing force. This will furnish a plausible explanation for the fact that the spasmodic contractions will disappear with exercise or become cured spontaneously after prolonged rest. Opposed to this, however, is the fact that the symptoms sometimes disappear after certain treatment influencing region other than the central nervous system. Now, this guy Rousseau, and I'm appreciative of Harger publishing this, this guy was a genius, and so was Harger, because this explains a lower motor neuron problem. And if you read this, if you're a veterinarian watching this and reading this, this will make perfect sense to you. In Stringhalt, there's been tons of case reports of axonal degeneration. This is a case report. You can read it. Again, the pasture-associated Stringhalt happens in Australia and other areas. This paper published in 2017. These horses, if you watch them on YouTube videos and that, horses that have pasture-associated Stringhalt, why is it in a herd of horses that are in the same pasture? Why do some horses develop Stringhalt clinical signs by false dandelion and others do not? There is an answer to that question. I have a very strong hypothesis on what that answer is, and I will share it later. But if horses are in the same pasture eating the same grass and dandelions, why are some horses developing pasture-associated Stringhalt and others are not? That is the exceptional question that I had to puzzle over too, but I will tell you later. But first of all, I would like to thank history. I would thank William Williams, who his book is exceptional for the 1880s. McCall, too, his paper is very enlightening with many opinions. He talks about when horses develop shivers after shipping in rail cars, or they are 1,000 times worse after rail car shipment. William Mitchell for his work as for doing necropsies and putting forth his pathological specimens, which the veterinary profession actually disregarded, thinking that it was a vitamin deficiency and that it was actually genetic. And then also Harger and the French veterinarian, army veterinarian Rousseau. I appreciate their knowledge and writing it down in history so that as I was doing my own research on this, gave me confidence that my own hypothesis on what the cause of Shivers and Stringhalt in equid species is true, and then figuring out how to treat these horses. So to come, part 2 is going to be the cause. So why are we seeing these clinical signs of Shivers and Stringhalt in horses? And this is fancy. She is actually the reason why, and one of my greatest teachers for figuring out why Shivers and Stringhalt is present in horses. She's a big gray Percheron. And I have to give thanks to the Ames Construction, Ames Percherons, and Travis and Jackie Shaw for their dedicated help in helping me also figure these problems out. Thank you very much for you guys' time, and any comments, just go to DeClueEquine.com. Thank you.